Hello and welcome to Season 2, Episode 89 of the Physician Assistant Exam Review Podcast. In this episode, we're going to be continuing our discussion of liver disease with cirrhosis and hepatocellular carcinoma. I'm Brian Wallace, founder here at Physician Assistant Exam Review, where we help struggling and overwhelmed PA students navigate and get the most out of PA school and ultimately pass the PANCE and land their dream job. That's really the goal, right? If you get something out of today's show, do me a favor. Share it with a classmate, share it with a friend, share it with someone that you work with a colleague. Tell them about the show. It'll help me and it'll help them, and it'll make you feel good about yourself, right? To do something good for people. So I would really appreciate that. One other thing before we jump into today's topic is I do want to let you know that through December 15th of 2021, so if you're listening to this far into the future, I'm sorry, this doesn't apply to you. Through December 15th, 2021, let's see if I can get this straight out of the gate. I'm offering a buy one, get one free sale on the final step. That means you can get a copy and I'm automatically going to ship you a second copy. That way you can give, like I asked you to do with the show, you can share one with a friend. You can give one to a friend as a holiday gift, a Christmas present, a Hanukkah present, or maybe we're a little late on that, but still that option will be available to you. It will not show up on the sales page. I didn't change any of the information on the sales page, but it will show up on the checkout page and you'll see that there and you'll hear from me on how to handle getting the second person all of the digital information. So as far as getting the digital version and getting the audio version. So just go ahead and make that purchase and it will, like I said, automatically go to you as two copies of that book. That way you can share one, give one away, whatever you like with that. All right, let's go ahead and jump in with our priming questions. Number one, what is fibrosis? What is fibrosis? These are the kind of questions that I think throw people off when you're studying topics and you don't understand the basic definitions that we're dealing with. What happens to prothrombin time in liver failure? What happens to prothrombin time in liver failure? Think about it. Do you know anything about the liver? We talked about it last week, or in the last episode rather, and you should be able to answer that question if you listen to that last episode. And lastly, what is asterixis? What is asterixis? And we'll cover all of that. So keep your ears peeled as we move through and cover those topics. All right, number one is cirrhosis. This is end-stage liver disease, cirrhosis. And the reason I asked in the beginning in our priming question is what is fibrosis? It's because our definition for cirrhosis is a fibrosis or scarring of the liver. And if you don't know what fibrosis is, then that definition isn't all that helpful. I've been doing a lot of definitions with my kids in social studies and in science, and people have a very hard time being clear on what they're thinking, at least my kids do. And they will give me examples. They will use hand gestures. They will do all the things that I do, but they will not be clear in their language. And they often use the term we're trying to define in the definition, which obviously doesn't help anybody. So what happens with fibrosis is it's essentially a scarring. You get normally functioning liver tissue being replaced with non-functioning scar tissue over time. So cirrhosis or end-stage liver disease typically is insidious and happens over months to years. It's not something that happens in a couple of days. It's not like a heart attack. It's insult after insult after insult to the liver over a long period of time. This damage gets replaced by scar tissue, and the liver stops functioning correctly. Portal hypertension and decreased liver function cause most of the symptoms of cirrhosis. You get portal hypertension because of the scarring within the liver. The hepatic and portal veins get compressed, so you wind up with a back pressure into the rest of the system, which will give us a lot of the symptoms. So you cannot know a whole lot about the liver, and you will still be able to answer a bunch of questions on symptoms and issues of cirrhosis, of end-stage liver disease, based on the fact that you can understand how the pressures work. Risk factors and or causes. So chronic hepatitis is a major risk factor here for cirrhosis. So we get hepatitis B, hepatitis C in a chronic stage will result in a lot of our cases of cirrhosis. I think it's the second most. The first most is chronic alcohol abuse. Chronic alcohol abuse. The liver's, one of its jobs is to remove alcohol from the bloodstream. Over time, that will cause damage. Another risk factor for cirrhosis is non-alcoholic steatohepatitis, which is the progression of non-alcoholic fatty liver. Then you can get drug toxicities, age greater than 55, diabetes, and obesity. I don't know if you can hear the leaf blowers running in my neighborhood. Somebody just started. It sounds like a whole crew of people coming through. If you can't hear it, that's great. If you can, well, I apologize. We'll have to work our way through it. Clinical presentation and physical exam findings. In this section, I combined them because I just didn't want to repeat the whole thing. And I went into a lot of effort to make these stand out and memorable, and I didn't want to do it twice because I thought that would make you actually lose more of the information. So clinical presentation and physical exam findings we're doing together here. So initially we have weakness and fatigue. You can get nausea and anorexia. Then I'm going to break up our symptoms into symptoms associated with a decrease in liver function and symptoms associated with a portal hypertension. We could just do all them all together, but I think creating these little groups, it makes it easier for you to picture in your mind what's going on. And if you can understand what's going on, then they're easier to hold on to, right? So, symptoms associated with decreased liver function. First of all, there's an increase in female sex hormones and a decrease in male sex hormones related to poor liver function, causing a bunch of different stuff. So, as the liver stops functioning well, we get an increase in female sex hormones and a decrease in male sex hormones. That will cause things like gynecomastia in males, but in particular, infertility, erectile dysfunction, loss of sex drive, and then strangely, it will also cause some vascular issues. I think the number was like 25% of people will wind up with a palmar erythema, meaning they'll get a red palm. And another one you see a lot here is spider angioma. I remember trying to remember this in school and really struggling because it didn't make a whole lot of sense to me, and that's fine. But spider angiomas are vascular lesions that are caused by that increase in female sex hormones. So these are characteristics of liver failure, of cirrhosis. You can also get ascites, which is a fluid buildup in the abdomen, elevated bilirubin, which will give you jaundice, pruritus, and dark-colored urine. Again, that's a progression. You'll start with jaundice, then it'll get itchy, and then the urine will get dark. You get a decrease in clotting factors. Remember, we talked about previously that the liver is responsible for creating clotting factors. So you can get some easy bruisability and increased bleeding times. Next, when things start to get really bad, we get hepatic encephalopathy, which is just kind of fun to say. So these are mental status changes caused by increasing levels of ammonia and other toxins typically cleared from the blood by the liver. You get things like forgetfulness, difficulty concentrating, delirium, and frank psychosis. Patients can get asterixis, which is a tremor or flapping of the hands when the wrist is extended. Again, that was one that always stood out to me in school, and I just never was able to hang on to it and attach it to hepatic encephalopathy, attach it to cirrhosis. Maybe it's because I didn't understand what we were talking about at the time, but it was a data point in the air that I just sort of hung on to by itself and never really attached it to liver failure. So asterixis is a tremor or flapping of the hand when the wrist is extended. These patients will eventually wind up in a coma if untreated. And then we have symptoms associated with portal hypertension. So you can get splenomegaly, caput medusa, which is when you get the portal veins around the umbilicus get distended. So you get the stomach has all of these, not stomach, let's call it the abdominal skin has all of these bright blue blood vessels throughout it. And it looks like Medusa's hair. Medusa being the, oh man, I forget what she actually was, but she was a Greek, there's a word for it, monster. I can't think of the right word, but she had snakes for hair, and that's where it comes from, is it kind of looks like she had this wild hair on the abdomen, these blue veins coming out. That was a horrible description. I apologize for that, but I hope you have an idea on your own what that looks like. You also get peripheral edema for obvious reasons, and then you can get GI bleeds. This is a little bit less obvious, but it is important. So GI bleeds, you get things like you get GI bleeds because of things like esophageal varices, gastric varices, and rectal varices, where you get that back pressure into these veins, and they become varicosities, and then they can rupture and bleed, causing some major, major issues. Okay, labs and studies. So I just told you one reason for it. One of the things you're going to be looking for is in these patients, or you may find in these patients, is anemia. Right? A GI bleed may lead to anemia. Another issue you need to know about is a folate deficiency is common in these patients. Why is a folate deficiency common in these patients? Any ideas? Well, one of our major causes is alcoholism. Right, and that may lead to a macrocytic anemia, a folate deficiency. You're also going to be checking for clotting issues. Again, they could have thrombocytopenia. They will have an increased prothrombin time. Their bleeding times will be increased. On a liver panel, they'll have an elevated aspartate aminotransferase and an elevated aspartate I wrote that twice. Okay, what I meant to say is they have an elevated aspartate transaminase and an elevated alanine transaminase. AST and ALT will be elevated. They'll also have an elevated bilirubin. What do you think about albumin? Will albumin be up or down with the patient with hepatic cirrhosis? Well, if you remember, albumin is a protein that we create mostly, or I think it might be all, in the liver. So albumin will be down. We're also going to test for viral serology. So we're going to do hepatitis A and C serologies if we think that's an issue here, if we're looking for a causative agent, something we can treat. Then we're going to do ultrasound. We're going to look for the size of the liver, the hepatic blood flow, and we're also going to check the size of the spleen while we're at it. And then you can do a CT or MRI with contrast for hepatic nodules, and lastly, a liver biopsy. Treatment. Cirrhosis cannot be reversed. This is scar tissue that's filling up your liver. We can't undo that scar tissue. Treatment and behavior modifications are used to relieve symptoms and slow that progression. That's really what we're shooting for here, is to slow the progression of replacing that good, healthy liver tissue with scar tissue. So what do you think our number one recommendation is for patients who have cirrhosis to slow down the process of adding to the problem? Well, stop drinking alcohol, right? Even if it's not your main cause, even if it's not the reason, even if you're not an alcoholic, the answer is stop drinking alcohol. Healthy diet and exercise, strict diabetes control. If you do have a hepatitis infection, antivirals. And then symptomatically, we're treating for edema and ascites, restrict fluids and sodium, diurese if necessary. For anemia, folate, 1 milligram daily, iron, and possibly a transfusion. For an increase in bleeding times, if it's a real issue, we can do fresh frozen plasma. And then finally, a liver transplant. Our last topic for today is hepatocellular carcinoma. 80% of cases are associated with cirrhosis. 80% are associated with cirrhosis. So our number one risk factors our risk factors are basically the same as, or they are the same as our risk factors for cirrhosis, which was chronic hepatitis, alcohol abuse over time, non-alcoholic steatohepatitis, drug toxicity, older than 55, diabetes, and obesity. Our symptoms are going to be, the whole thing is a little bit vague because it depends. There are multiple types of liver cancer. So there are multiple presentations, there are multiple treatments, there are multiple lab findings. We are not going to go into any real detail as far as all that goes, right? You're not going to need it for your PANCE. You may need it in your practice, but if you do, it's a little bit more than we're going to do here. You're going to have to find another resource to go deeper into the rabbit hole of liver cancer. What we're going to talk about here is just a very, very superficial view of it. So we have a basic understanding of some of the things we can do, some of the things we're looking for. But really the real understanding here is that most of the time it comes from a pre-existing condition like cirrhosis. Our clinical presentation is a patient who was previously pretty stable with cirrhosis and now has become unstable. So sudden ascites, cachexia, which is muscle atrophy, and significant weight loss. Those are things that might clue you in that things have changed here. Lab studies and physical exam findings: elevated white blood cells opposed to often decreased white blood cells in cirrhosis, elevated alkaline phosphatase, elevated alpha-fetoprotein, CT, MRI with contrast, and then you're going to do an ultrasound and liver biopsy to get a better look at all this. Treatment. Obviously, prevention is number one. So hepatitis vaccinations, that sort of thing. Restricting alcohol, good diet, keeping diabetes under control, not being overweight, all those things will help to not get to this point. Pain management is going to be important because expansion of the liver capsule can be very painful. Surgical removal may be possible, but it's only like 10 to 20% of carcinomas can be fully removed. So one of the things that I didn't understand when I was in school, but if you think about it, it's not hard. I don't know. It never occurred to me. If you're looking about removing cancers, the tissue has to be amenable to being resected, right? So if you look at, let's say, brain cancer, it might be easier to think about than liver cancer. Depending on where the lesion is, it may be right there, and you may see it on MRI, but you can't get at it without going through tissue that will cause a problem. You can't remove all of it without potentially causing a worse problem. So only about 10 to 20% of carcinomas have the potential to be fully removed with liver cancer. At least that's the numbers I found. So it's not so easy as just say, go and cut it out. Although if you can, that's great. And lastly, our last treatment here would be a liver transplant. All right. So that brings us to the end of the liver. In the next time we get together, what we're going to do is we're going to talk about metabolic disorders, and we'll go through those. And then I think all we have is some nutritional issues, and then we're going to wrap up GI and be done with it. So that's really, really soon, which is great. Maybe the next 2 shows, and we'll be done with GI, which would be fantastic because I'm starting to work on putting together a really, really nice review system for the sections I've covered in season 2. That'll be out in early 2022. Actually sat and did a lot of work on that today, thinking out how that's going to be. So I'm super excited about that. So the more of this kind, every time I finish a topic, that's one more topic I can add to that review guide. So that's really exciting. You guys will see that in 2022, provided you are on the email list and still listening to the show. I'll give you plenty of information on that. All right, let's go through our study tip for today. Our study tip, I've got one huge one. Is really, really simple, but it's huge. At least it has been so far for me. I get every year, and I've talked about it a lot on this show and a lot in the emails, I do a lot less work in the winter than I do in the summer. Let's just put it that way. The lack of sunlight takes a huge toll on me. It really slows me down. And the fact that I'm in the operating room, which has no windows throughout the daytime, compounds that issue, right? So I have days in November, December, and January where I don't see the sun because I'm in the OR when the sun goes up, and I'm still in the OR when the sun goes down. And like I said, that just plays a toll on me. Maybe I get a little depressed. I'm not sure. You probably ask my wife; she'd give you a better story. But I know that 5, 6 o'clock rolls around, excuse me, and I don't feel like doing any more work. I'm kind of done. I'm cashed out for the day. Or if the sun's out, I'll be at the kids' baseball games. We'll be running around. I'll get home at 8 or 9, and I'll still get some work done that night. And so it's a major issue for me where I don't want to say I lose 2 or 3 months a year, but I definitely get a whole lot less done. Well, last winter, I can't remember why, but I was talking with a general surgeon who is just a great guy. He's a fantastic surgeon, fantastic guy. He's been doing this a lot longer than I have. And he was telling me last winter that his wife made him go and buy a light box because he had gotten so grumpy in the wintertime and so useless in the wintertime that she made him do this, and that it made a tremendous difference for him last year. And this is a guy I absolutely trust. So this year, as November hit, I started researching these things, and I wound up getting one. And I got to tell you, over the month of November, it has made a tremendous difference for me. I find that at 5, 6, 7 o'clock at night, I don't feel like I'm passing out at my desk. I feel like I'm ready to go. like I'm still functioning. I can't say, obviously this is anecdotal. I've got I'm a one person experiment here, and it's not controlled whatsoever. Sometimes I turn it on, sometimes I don't, but I definitely feel as though I'm getting more work done. I bought a Happy Light from Veralux. I think it was $40. So I'm not talking about a huge outlay. I'm not talking about $500-$600. And I turn this thing on and I tilt it off to the side of my desk. And like I said, I feel better. So as you go into November, December, and January, you may find something like this makes a big, big difference for you in the amount of information you can get through and the amount of information you can retain. So it's definitely worth considering and keeping an eye out for. Like I said, $40, definitely worth a test drive. All right, let's move on to our priming questions. Oh, one thing before we do that, the priming questions, if you like them, that's exactly how the final step is set up. And what I did was for the GI section, I actually made it so you can go ahead and get a digital preview of the GI section, 25 questions from the final step, directly from the final step if you go to www.physicianassistantexamreview.com / the numbers 25GI, so 25 GI for the 25 questions, and you can get those absolutely free, no strings attached. It does bring you into the app. That's where all the digital material for Physician Assistant Exam Review is now being hosted, and it's really slick and really nice. So that'll give you access into the app, and you'll see what's going on there, and that'll give you those 25 questions. So anyway, let's answer our priming questions we've got here today. What is fibrosis? Now, hopefully I've talked about this enough ad nauseum throughout this show today, and you can tell me what fibrosis is. I want you to say it out loud. Don't just picture it in your head. Use the words. That's what makes this so hard. It's a scarring of the liver where connective tissue replaces normal functioning tissue. Hopefully you gave me something in that ballpark. What happens to prothrombin time in liver failure? What happens with prothrombin time in liver failure? Again, to me, this is one you should be able to know really easily without knowing a whole lot about liver failure. It goes up. The liver is no longer making clotting factors, or it's reduced functioning in clotting factors, so prothrombin time will increase. What is asterixis? What is asterixis? It's a tremor or flapping of the hand when the wrist is extended. And what does it indicate? Hepatic encephalopathy. We took that one step further. Hepatic encephalopathy. All right, so that'll take us out for today. We finished up the liver. Like I said, we're moving on to metabolic disorders next week or in the next show. And like I said, we're going to be doing two things. One is make sure that if you're interested in the final step, this is going to be the best time you're going to be able to get it. Probably the best price I'll have on it all through 2022 as well is the buy one, get one free offer. If you just head over to www.physicianassistantexamreview.com / the final step or / TFS, I think I have it set up for both. You'll be able to access that pretty easily, and you'll be set up with 2 books for the price of 1. And then again, if you're interested in the priming questions, more like that for GI, www.physicianassistantexamreview.com / 25 GI, and you should be in good shape to take care of all that. All right, if you're taking your test this week, good luck. I can't wait to hear how you do. And if you've taken it or you are taking it, please let me know how you do. I love to get those emails from people, pass or fail. I do love to hear from you, and let me know how you make out. All right, take care. We'll see you soon.